So, some good news for once. So, this article from The Independent. Doctors should stop prescribing homeopathic medicine to NHS patients because the health service has said the change has been proposed because, at best, homeopathy is a placebo and a misuse of NHS funds which could be better devoted to treatments that work, said Simon Siemens of NHS England's chief executive. What have we been saying since pretty much this channel's inception? And the only reason this happened in the first place was demand on the NHS. Basically, the public said, we want, homeopathy. And they went, well, if you want it that badly, go on then. And because of this, studies were carried out, and all the studies you now see nowadays are from, NHS doctors, government funding, to find out, how good it works. It doesn't work. We've said this, but we knew that even since the beginning. This has been a colossal waste of money to the NHS. And it gets worse, because the NHS, according to the article here, currently spends £92,000 a year on natural treatment, which is highly diluted doses of natural substances that some claim can help the body heal itself. Recommendations set out in a consultation document categorise homeopathy as a treatment with a lack of robust evidence of clinical effectiveness and say GPs should not give it to new patients in a drive to cut prescription costs. Often patients receive medicines which have been proven to be ineffective or in some cases dangerous, says the document, noting that there are often more effective, safer and cheaper alternatives. Last year, 1.1 billion prescription items overall were signed off by GPs at a cost of 9.2 billion, an amount health bosses have been tasked to reduce through increased scrutiny of the medicines provided. The national guidelines named 18 treatments that should generally not have been prescribed and sets out actions on limiting the prescription of around 3,200 products, such as eye drops, cough mixture and sun cream, which are commonly available over the counter in chemists and supermarkets. Other treatments that could soon be banned by the NHS include herbal treatments, iodine plasters, I think that's how you say it, omega-3 fatty acids and unlicensed use of painkiller Proximol, which was withdrawn from the market in 2007 due to safety concerns. In March it was revealed that the cost-cutting plans could stop NHS doctors from providing travel vaccinations and prescriptions for hay fever tablets and gluten-free food for cholerics. The NHS is probably the world's most efficient health service, but like every country there is still waste and inefficiency that we're determined to root out, said Mr. Stevens. The public rightly expects that the NHS will use every pound wisely, and today we're taking practical action to free up funding to better spend on modern drugs and treatments. The plans are at the centre of a formal public consultation aiming to save the health service $250 million a year. Professor Helen Stokes, chair of the Royal College of GPs, said that it was appropriate to take safe, sensible measures to reduce prescription costs, which are a significant expense for the health service. But she warned that by forcing everyone to buy common medical items previously available on prescriptions risks alienating the most vulnerable in society. We know that a number of treatments are of little or no value and are at best a placebo. She also said, we also know that many other medications are available very cheaply over the counter and are much more reliable and readily obtainable than when they first become available on prescription. And both GPs and the public should be mindful of this. If patients are in a position that they can afford to buy over-the-counter medicines and products, then we would encourage them to do so rather than request a prescription. But imposing a blanket policies on GPs doesn't take into account the demographic differences across the country, nor does it allow for flexibility of a patient's individual circumstances and risks alienating the most vulnerable in society. There we go. So, that's good news, to be honest, because quite frankly, homeopathy just doesn't deserve this seat at the table, at the NHS. So I'm very, very glad that it is being rooted out, to be honest. Should have happened a lot sooner, and there wouldn't have been at least as much waste. I mean, if it's 92,000 a year, think of that over the past 10 years, how much money we could have saved. But it's better sooner rather than later, so that's something, I guess.